Well, thank you so much, Valen. Yes, we do continue with this broadcast as we highlight a number of social ills and bring forward some interventions on how to deal with them. And number one in that list is, of course, the local government here, or the provincial government here's initiative. It's called Operation Sugumasake. A number of ways that it's dealing with various social ills here. One of those problematic issues in the province and also in this particular part of KwaZulu-Natal is HIV/AIDS, and health practitioners here saying that it's not very impressive when they take a look at the statistics. And let me bring those stats to you. Between October and December last year, 10,465 people were tested for the virus. It's a good thing that they got tested. 646 tested positive. So let's discuss this matter a little bit further now. I'm joined from the Provincial AIDS Council by Xolani Kunene. Good morning to you, sir. Thank you so much for your time.
Good morning to you, and thanks for having us.
We've spoken about the figures of HIV/AIDS in this area. Is the message of either abstinence or condomizing, is it going through?
Well, the message is out there, as you've alluded to the stats that people have come out to test and to know about their HIV status. I think that one needs to be uploaded, and the work that the government of KwaZulu-Natal has done so far. But we also want to see more people coming forward, because the 10,000 that you are referring to, it's just a fraction of the people who are staying in the area. So we want to call upon every person in each and every household to come forward and test, so that it becomes easier even for government to plan, because once we know, or once government knows how many people that will need help, then it will be easy to put all those programs in the IDP, in the local municipality, and even in the province. And as civil society, we are definitely saying we are happy with the initiative that has been established today. We want to see people using the services, the Operation Sugumasake vehicle that has been donated by Toyota. That people must use it, especially men, because men tend to stay at home and they use their partners to test for their HIV status. So now that the service is going to the community, for the community, then we want their community, especially the men community, to make use of the services.
I was going to ask you how people in rural areas will be able to receive treatment after they've been tested, because it's one thing to test and then now you need to follow up with regular treatment, but you have spoken now about that public-private partnership that will be making sure that a vehicle will be sent to rural areas. This brings me to my next question then. How empowered do women feel, especially in rural areas, to be able to say to their husband, we need to use a condom?
Well, that is still a challenge. It's a biggest challenge, but it's not something that will keep us at home. We have to work on it every day as we wake up and attempt different interventions. We have to empower our women, but we also have to empower men, because one of the problems maybe is that men don't know that they have a role to play. They think they use that cultural background and they think they are superior. They can even make wrong decisions and they think those decisions are right. So as PCA, as civil society, at the ward level, we are saying to ward AIDS committees, the message must go out there to say to men, support your partners, and as men we must support each other, because if I share my pain with another man, maybe it's much more easier and I can get advice. So we need to work together as men and as women.
And also perhaps discuss those gender issues, because maybe some men will say, I don't want to be treated by a woman. I don't want a nurse. It's just uncultural for me. So perhaps education on that is. But let's talk about young people. It's very important that you reach them and you prevent HIV infection on their level as well.
We have a program called Isibaya Samadota in the province. Different districts have started implementing that program. That's where we have men of all ages coming together to discuss issues that affect them, their fears, and the pain around the medical male circumcision. It's one thing that also try to discuss and encouragement to make use of that service. So Isibaya is seen as one intervention that will be usable for men to talk about their issues, but also encouraging them then to take the message from Isibaya back home, because to assume that women knows everything, it is wrong. So once we share this information with men, they must go back and talk to their partners and then work together moving forward.
Thank you so much for that information. Xolani Kunene is representing civil society, coming to us from Provincial AIDS Council. It's quite important that we have the adequate information. I mean, something like reinfection two people, both HIV positive, might think it's okay not to use a condom, but there is that matter of reinfecting each other with different strands of the virus. So that's also something that we need to educate ourselves as a public on. But let's leave it there at least for now. Go back to the Johannesburg studio.